Welcome to the No Shame podcast. Still shooting from lockdown isolation, but we've got some more news. At least we have a plan now to be able to get out of this. So today we have Dr. Jérôme Fennell. He's the head of the infectious disease control here in Tallaght Hospital. I've got him on the podcast just to answer some questions for us. Some stuff I've seen floating around on social media. Obviously, when a new phase, I think, gets announced, there's going to be more questions that come with that. And I don't think we got a lot of the questions answered. We got the bullet points, but I can see lots of questions. I can see a lot of worried people out there, a lot of worried business owners, especially in the fitness industry. And I'm going to try and get some of the answers today off Jerome. Jerome is also a purple belt in jiu-jitsu. He actually might be more now. I'll confirm with him when he's on. Happy birthday to myself. So it's my 32nd birthday today, shooting from the podcast studio. On my own. I remember actually when I was setting up this building, sitting out there, I was putting up a prefab, I think it was, so a wall, a studded petition wall, and it was my birthday as well. So maybe it's starting to blend in that I spend my birthdays in this building. On my birthday, I also, this is a story I think a lot of people know, but my name is Patrick Pearse Holohan. So I was named after Padraig Pearse, so one of the rebels that was that led the 1916 Easter rebellion. I always had a connection with this kind of because of my name before I even knew the history of the rising. So I've always had an admiration for Padraig Pearse. When you read some of his stuff that he wrote before he was executed, so he was in a cell with next to his brother Willie the night before. He didn't think his brother Willie was going to be executed. But unfortunately, I won't know the story. But if you want to go down a little rabbit hole, no matter what country you are, we've got listeners in America, all over the place, New Zealand, Sweden, Finland. If you find like you like a little bit of history, go down and discover this man. There's a poem that he wrote on the day of his death. Amazing. It's the day he was executed. So he was executed in Camelham jail at 6 o'clock in the morning. So at dawn. And then that would have followed the rest of the revolutionaries to be executed after that. But Padraig being the first one. It's an amazing. There's some amazing stories in there. The story between Grace Clifford and Plunkett as well is another story that came from that passage of time that has stayed with people for a long time. The song obviously Grace, if people have heard, is amazing. I'm going off the subject in anyway, but if you feel like you want to have a little look down something that's an amazing story, the relationship between Padraig and his mother. And I only posted it on my Instagram today. It's a letter to his mother before he died. There's a part in it where he says to his mother, picture it like this. Don't be sad. That this is our calling from God, if you must. So we have to sacrifice us for the greater of other people. He ran a Gaelic school. So Padraig's idea was about bringing the traditions of Gaelic Ireland back to life, and especially the language. St Enda's, which is not too far from the studio here. Another amazing building and an amazing part of the man's legacy. He writes in the letter about the will of his brother of seeing his brother and the people or the students of St Enda going on in the future and doing well. To know the story and know where that man must have stood. The people in Dublin didn't respond well to the rebels either. So at this time they would have been seen as people that were like thugs and rogues. It was only until the executions of them that people started to see the stories that I'm talking about here. It's an incredible story, but it's definitely a time that I think the whole world can recommend where a guy or can remember a man that was a tremendous leader and somebody that was willing to put his life before everything else. I think a lot of people talk about this or a lot of films that we see are fantasized about this, but this is an actual story of this. Won't keep blabbering on anyway, so I'm going to get Jerome on now and I'm going to ask him some questions about this. So Jerome was a really cool guy. He used to train with him back in the day. And he had a podcast with Lachlan Giles there not too long ago as well, but it was hard to get somebody on out of the health sector, to be honest. Maybe because they're so busy at the moment as well, but a lot of people don't want to say the wrong things as well. So that has to be respected, and I respect Jerome coming on, but Jerome's a straight shooter and I'm going to try and get some good answers off him. So there we go. Hey Jerome, how are you getting on, my friend?
Hey Paddy, how are things?
I haven't seen you in a while. I've seen you in social media land, so I've got to kind of see you still going along. So I know you're still alive and you're breathing and you're doing well.
Yeah, not too bad.
That's the good thing about social media. I have to say, it's one of them things where you can nearly pick up in someone's life where you've left off, isn't it?
Yeah, no, it's good for keeping contact. I suppose it's got its downsides too.
Yes, absolutely. Like everything. I was explaining before you came on, so you are head of the infectious disease control in Tallaght Hospital, am I right?
So I'm a consultant clinical microbiologist, and I'm looking after infection control, which is kind of prevention and reduction in infections throughout the hospital.
Right, so this is definitely your department that you've been dealing with the next last little while.
Well, it's certainly kept us really busy. Now, I'm not a virologist, I'm not an epidemiologist, I'm not on NEFIT or anything like that, so I'm not like a national expert or anything, but I suppose I have some half-educated kind of assessment of what's going on.
The reason why I want to get your assessment is because obviously there's a lot of people that in my land of jiu-jitsu and gyms and stuff like that. So we'll get to that anyway in a little. But you yourself, you know exactly what we're talking about when we're talking about close contact with jiu-jitsu.
Absolutely. No, it's what kept me sane for the last 10 years. Yeah.
Yeah. So you're purple belt now?
Yep. I got my purple belt from John about 2 years ago.
Oh, incredible. Are you still training?
Well, not for the last couple of months, but up until then, yeah.
Yeah.
So I've been training with Chris Bow and Gracie Baja.
Chris is an absolute mean man. Well, when I mean that, I mean jiu-jitsu wise. In the world wise, he's absolute gentle giant.
Exactly. Yeah. No,
he's a mean man. So where do you think we are with all of this at the moment? I was supposed to. I announced that I was going to be talking to a doctor on this about and trying to get some answers, especially for the community. But last week we were supposed to have this, and I think it was wise for us to wait till now because we're to a whole new plan.
I don't know. I mean, who knows? This is something like nothing else I've ever had to deal with, or nothing else any of us have ever had to deal with. In terms of the curve, I think we're probably just around the peak or just past the peak. So I think our first case was the 29th of February. So what was that, about 2 months ago? So, it's roughly same again, hopefully until things get close to zero. But obviously now we're going to start this whole new process of lifting restrictions gradually. And, I think 10th of August is the hopefully when we reach stage 5. But I think it has to be said that the plan that came out this week is a best case scenario. There's a real chance that we'll, be hit by a second or a third wave. And I suppose my fear will be going into the winter that people will be completely fed up. They won't want to do social distancing. We'll have the flu season, we'll have the COVID season, we'll have all the normal winter problems. And then the hospital will be potentially overwhelmed or overrun.
That's definitely something that I've kind of seen in the future myself. That because there's so many people. You mentioned the word there, getting fed up in a way, and it's hard to be motivated on something. I think when I can kind of see a goal in something, I think that might be to do with being an athlete or just jiu-jitsu, that I've no problem sticking my head down and swinging the axe. You know what I mean? If you just keep going.
That was the good news out of Friday, is when that report came up. At least there's a plan, and there's hopefully light at the end of the tunnel. But yeah, we'll have to see what happens. And I suppose we have the advantage of looking at other countries that are a couple of weeks ahead of us. Countries like Germany and Spain and Italy, and seeing what happens as they lift the restrictions, and whether we need to roll back some of our some of the restrictions that have been lifted. We may have to fall back to where we were.
That is the good thing. I think the world has seen so many different approaches to this, which is, as I can imagine being an alien looking in, you would be thinking, like, would they not pick up the phone and communicate with each other? Because there's so many different approaches to it, isn't there?
Yeah, and not only, I suppose every country is a little different in terms of their health structures and the age breakdown of the population, and what's available to them in terms of resources. But yeah, it's interesting to see the differences. And the other thing is we're all competing against each other, for PPE and for the reagents and the testing. And that's definitely led to problems. And I think we probably shouldn't be comparing ourselves too much to the UK and the US, because they aren't, I suppose we always compare ourselves to them because we share a common language. And obviously a lot of us have lived there. but they're not doing it well, and it's probably not the standard we should be comparing ourselves to.
That's a great point. That's what I was going to lead on to, because I do see a lot of that. I was like, yeah, but hold on, look over there, and it's like I think when we're looking at numbers and people, and we're not talking about climates and stuff like that where it's worse in a warmer climate, or it's worse in a cooler climate, because some viruses can do that, can't they, where they can survive some places.
Absolutely, and maybe some of that will come out, and and there's this hope that that the virus won't survive as well in our summertime, but we don't know that for sure, and it's not something we can rely on.
Yeah, because that could be something where it was the opposite, because some viruses are like thriving in them situations, isn't it?
Yeah, I mean, generally, the colder it is, the better it is for them to survive, and that's why we get all the winter respiratory viruses. And I suppose the hotter it is, the more UV light you get from the sun, the more virus breakdown you get. But obviously, like you said, there's no hard and fast rule for each virus. Like, they all have their own different ways of surviving.
So for yourself, I hope you don't mind me saying, you had contracted COVID-19.
Yeah, so I went back to work now about 2 or 3 weeks ago, and yeah, it was rough. So the first thing I noticed, my head was kind of a bit heavier than normal, kind of had that heavy kind of feverish kind of feeling, and I was like, hold on a minute, is this it? So I got myself tested, and that came back positive, so I didn't go back into work until I got the results. And yeah, I mean, I felt fine for the first couple of days, and then I had more kind of gastroenteritis type symptoms, and probably the worst headaches of my life. Fever is up to about 39, so and it took me a good 2 weeks to get over it. So it was rough. Definitely not like any flu or cold I've ever had before.
Not like a round with Chris Bowe, no?
Nah, that would be a lot quicker and probably more merciful. It'd be over quickly.
So you just finished the shift. Am I right in saying that as well? You just
I went into work this afternoon. Yeah, just to.
So what? Because everybody's on the outside now. So people would ask me in a way, well, look, what's a lot of fighters and back in the day? Like, what's it like to go in there? Like now, like obviously we're all looking at the outside, and what's it like to?
So I suppose first of all, I'm not really. I mean, I see patients and I might put on PPE, but that's not all I do. I'm also involved in management type stuff and overseeing the lab and meetings with the infection control nurses, and so. So the patient is part of my work, but I'm not like the frontline nurses and doctors who are in there, every day, in and out, all day. So what's it like? It's been very different. The workload is completely shifted there for a few weeks. So normally we have the full range of different infections to deal with. This just went pretty much pure COVID. Like our ICU seem to be almost completely patients with COVID. And I think there's one message that really needs to get out there. I'm worried that people who need to be in hospital are afraid to come to hospital. We aren't seeing the normal strokes and heart attacks and appendicitis and all the normal things that people come to hospital with. And I think we're just worried that there are people at home who are suffering that are just afraid to come home. And, they would be better off coming to hospital and getting looked after. I mean, we've had to deal with COVID, and it's really taken up a lot of our work. But there are certainly there are wards in every hospital now that don't have COVID, and we are able to look after the more urgent cases. So I suppose I would urge anybody who needs to go to hospital to go to hospital, because if you don't, your outcome might be worse.
Yeah, that is because there's going to be a byproduct through all of this on all sides, isn't it? It's going to, after a little while, it's going to start turning into mental health problems, and people that are say recovering, recovering alcoholic, all sorts of stuff. You know what I mean? It's going to be a lot of obviously there's mad rises in domestic violence. There's kids that would have went to school, and that's where they would have got their breakfast with breakfast clubs and stuff like that. So it does start linking into other kind of graphs, if you must, doesn't it? As the time goes on.
And the real concern would be down the line, if we had a second or third wave and the hospital was overwhelmed, then the people who are going to die are not just the COVIDs. They'll also be the ones who need their normal care, and the hospital won't be able to provide it because they're overrun. The heart attacks and the strokes and all the rest.
So I hear people keep fighting this corner of sure it's just a normal flu, and they keep throwing up the same numbers of flus. I seen something the other day, and it was I think the death rate last year in Ireland was 30,000 or something like that, and it was similar close, or it was a similar number now, but that obviously that's a full year, and it hasn't gone through the winter flu season meeting the COVID at the same time.
I mean, the flu numbers, I'd have to look it up, but I think we see maybe 200 deaths a year from flu. But we don't always test everyone. I think the mortality from this is about 20 times worse than the flu is our kind of estimation. I've never seen a virus that behaves like this. And even personally, when you get this virus, psychologically, it's different. When you get a flu, you're probably going to be fine. You might have a rough week or two. But something like this, you start thinking, are you going to be one of the unlucky ones, particularly if you're older and have any health issues? So thankfully I wasn't. But yeah, no, it's a totally different ballgame to the normal flu. And I mean, the flu itself is severe, particularly the elderly. But this is on a whole different level.
So there was cases of the COVID-19 in Ireland, I think, before the time that they'd been confirmed as COVID-19. The girl that had landed and went up. So they've said that there was people that might have had COVID-19 before that, and that there's a possibility it could have been in places before.
I think our first case that we knew about was February 29th was when it was reported. I think there was that lady who had traveled to the north, like you said, from Italy, I think, who was possibly positive before that. I can't remember exactly. So as far as we know, that's when it started. It's possible that there were cases a week or two before, but and I think the virus reference lab in UCD were quite quick to get a test up and running. I think the sequence only became available in January, and I think they had a test up and running about a month later.
At the end of, say, I think it was maybe even halfway through February, I got a flu, Jerome, and many have said it like me, and I'm not one of these tinfoil hat people that try to find as many, but I don't really get sick. I don't get sick a lot, what I mean? Even if I do get flus, it's usually okay, I'm all right. But I got a flu, and my temperature was up to 40 degrees. I think I recorded, like, my young son had it, Chelsea had it, and we were sick for 3 weeks. There was a day where I had slept through the whole day, and Chelsea got my class covered and all for me, and I didn't even really know, and sweating really bad. I'd never had anything like this in my life. Now, if I had been in a situation where the three of us were that sick, and it was now, I would be panicking.
Yeah.
But if someone had even told me that people die of the flu, and the three of us were sick, I would have well, it's never going to be us. USA.
When did you say that was, in February or January?
It was in the middle of February. It was, so say maybe the start of February, middle of February. I had it for 3 weeks now.
Yeah, no, it's hard to know. Maybe, especially if you're a politician shaking everybody's hand.
Don't call me that.
I mean, there's a good fair chance that was a flu as well. We probably won't know. Maybe when there's a proper antibody test, you could be tested and see. But I don't know whether that really was this or whether it was the flu. I suppose if you come down with COVID again, in the meantime, we'll know it wasn't. But hopefully, for your sake, that's the end of it.
I hope, because immunity as well. It was actually somebody in a shopping centre today that I was talking to, and he was like, I think we had it, hopefully, because they came out with some, they only released something the other day, he said, that where there was a possibility that you could have been immune to it. Has that been discovered yet, or is that just a supermarket talk?
I suppose there's two really important things we need to figure out. I suppose, first of all, can we be immune to it? There's all sorts of different viruses, and some, like winter vomiting, you're probably only immune for about 3 weeks. But something like chickenpox, you're probably immune for the rest of your life. So we don't know where on that spectrum this is going to be, how long, if there is any immunity, first of all, and second of all, how long it's going to last. So that really remains to be determined. And the other thing is, even if you can't become immune to the virus, that doesn't mean that we couldn't get a vaccine down the line that would work. So, yeah, a lot of things still up in the air.
If there was an idea of you becoming immune to it, would you still be thinking it would be smart for somebody to be eligible for a vaccine? Would they?
I think they would probably encourage people to get the vaccine because I don't know whether we'll know how long the immunity lasts. If it's a case like chickenpox that we feel the immunity will be lifelong, but to be honest, it's going to take years to figure out how long the natural immunity lasts, or else if it doesn't last, then we'll find out much earlier, of course.
That's the thing about these things; it has to take time.
Yeah, no, that's a lot that's going to be revealed in the next year or so.
So regarding the first phase, so the first phase is let me have them here. It's so there's people from different households are able to meet with each other. So
okay, I'll see if I can.
I can read this. So phase one, it says allow outdoor meetings between people from different households, open up childcare for healthcare workers, phased return of outdoor workers, open retailers which are primarily outdoor for those which were open during the first level of restrictions, e.g. opticians, opening of certain outdoor public amenities.
Yeah, so I think it's the first stage. It's going to be reviewed every 3 weeks, and I think they're still hoping people will be able to talk to each other, but still stay 2 meters apart. That would be my impression from what you were saying there.
So in the outdoors, do the viruses act different? Do they drop quicker? Do they blow away? Do they?
I suppose that you don't have walls, so the virus isn't confined. The virus should diffuse more, and if people are far enough apart, there should be less of a risk.
Before I even went on to these phases, I should have asked you a question about the testing, because you mentioned the question of testing. Gonna butcher this word, I am for sure. Right. Is a trachearme lavage or something like that it's called?
Lavage, is it?
Oh, that's the one. That's the one. Even if that was right in front of me, Jerome, I wouldn't have gone.
No worries. So your trachea is your breathing tube, the one you try and choke in jiu-jitsu sometimes.
Yeah.
In a guillotine or whatever.
Someday again.
Yeah. So lavage is French for a washout, and basically they flush a bit of saline down the pipes, and then they suck it back up, and then they send that off to the lab. So that's what they would call a deep respiratory specimen. So we can get a nice deep sample, and sometimes what we see is the nose swab isn't good enough, and we see a lot of patients who might come back negative on a nose swab, but if you get a tracheal lavage or a deep respiratory specimen, then it comes back positive.
And when testing for that, Jerome, are they actually looking for, now I'm going to sound stupid probably after this, but the actual corona, the COVID-19, the actual thing that we're all seeing on the sign, which is
it's basically it's using technology that won the Nobel Prize. It's something called PCR, which is polymerase chain reaction, and all you need to know is that it's able to pick up a very specific piece of nucleic acid, and then it multiplies it out, and then it's able to pick it up. So basically what it's detecting is the kind of genetic code of the virus. So it's not picking up the virus itself, but if the code is there, the virus should have been there as well. Now the problem is if that virus is dead or broken down, you may still be able to pick up the code, that RNA or that genetic code of the virus. So so it's possible that, I think they say, you should be isolated for 2 weeks, but you will probably continue to be positive even when you're no longer infectious. So you will be you'll be positive for longer than you are infectious, is what I'm trying to say.
And would that be like the normal protocol for testing for something like this? Because I thought I read somewhere that the guy that he created the test said that it's probably not the best way to test for this virus.
I suppose it's very specific in that it's very good at picking up this virus and not being confused by another virus. It's probably quite sensitive, but it's probably not sensitive enough, if people don't swab themselves deeply enough, or if it's gone into the lungs rather than the nose and throat, you might not pick it up. I suppose what would be ideal would be if we could pick up the virus itself and say the virus is there and the virus is intact. But that's much more elaborate. That's probably much more expensive. You have to grow the virus. That's not something that's practical on a large scale. You can't get a swab and grow a virus and wait a week to grow up the virus on, thousands and thousands of people. It's just not possible.
So it is important to get that 48-hour turnaround on the testing. Is it for the numbers to be accurate as well?
I suppose you're trying to shut this down. You're trying to track it. So time is of the essence. So in something like this, when we're trying to reduce the number of people who get exposed, the sooner you can find a source and find out who their contacts are and isolate those and take them out of circulation, stop them from infecting other people, the better. So the faster the better.
Sorry, I'll go back to the phases with you.
Okay.
Thanks for answering that, because I had that in my head and I was like, I'm not gonna get this word, but answer my question, because when I was reading up on that, it just didn't make sense to me. What they were extracting, were they extracting the COVID, or were they extracting what you were saying, the genetic coding of what it is? So phase 2, allow visits to households, including to homes of over 70-year-olds, travel to be extended to 20 kilometres of your home, develop plans and support to open up businesses with consideration for safety of staff and customers, open small retail outlets and marts where social distancing can be observed, open public libraries, immediate families and close friends can attend funerals. So phase 2 on 8th of June. Now I will say what you said as well, that this is a very kind of, to be able to go to the date and this all to happen now is kind of far-fetched at the time.
I think the phrase they use at the beginning is it's a living document, in that it's going to be open to review, and things could change as things become apparent, whether that's changes in people's behavior or whether that's increase in virus numbers, or numbers going into intensive care, or if the hospitals are under pressure.
If this happens, does that paragraph mean that like grandkids and grandparents can meet if all going well?
I'd have to go and read it again, but I think I think initially people will be able to meet, but they would hope that you would still try and social distance as much as possible. Now I know it's going to be difficult at times, and I would hope that people would still try and just minimize the things they do, so not see everybody and everyone, and maybe stick to the same people. And I think it's going to be difficult to try and follow these things for as long as it's going to take.
It's hard not to hug your granny, isn't it?
Yeah, absolutely, and we can understand that, but at the same time, I think when things are finally lifted, I'd imagine people will just want to go bananas and go partying, and that's probably not what we need right now. It's going to lead to things taking off again.
My own mother, I'm 32 today, and she said to me, I can't give you a hug and it's breaking my heart. And I was like, you should have just said nothing.
Yeah.
It's all up and down the country, yeah. I think even especially, I don't know, even in the Irish culture, your granny and your granddad, and
absolutely, but it is hard for everyone. But at the same time, you don't want to give them a virus, you don't want to send them into hospital, or you don't want to end up in hospital yourself. And that's what we're trying to do, is trying to like they were saying, flatten that curve and reduce the number of lives lost.
So phase 3 is projected for the 29th of June. It says, allow small gatherings open of creches, child minors and preschools for children of essential workers in phased manner. Return to work for those with low levels of interaction. Open non-essential retailers, outlets with street level entrance and exit, and open playgrounds.
Mm-hmm. So basically, at each stage, we're kind of seeing how it goes, and you're hoping that the virus is present at a low enough level that these kind of things can happen without significant spread. So you hope that the numbers are pretty low, and if the virus is rare enough, things like that can happen without it spreading.
Because I think with the playgrounds, it lives a lot on aluminium and stuff like this for days. Am I right in saying that?
I've seen a few different papers. I think it's kind of around 2 or 3 days. But if things are cleaned, that should remove it. It's not a particularly tough virus. Every disinfectant should pretty much work against it. It's, in terms of environmental survival, it's not particularly tough or different to anything else.
A nurse did a great video on it. Was amazing about contamination. She put paint on her hands, and then the other prone, and with the time she was covered. So, like, I think
that's one thing you really find when you're putting on the PPE is it is so hard to do anything, and particularly there's a lot of the intensive care patients, for example, they find that they do better if they're ventilated on the front, so they're kind of lying on their front. So they have, so instead of lying on their backs, they do better on their fronts.
That called proned?
Proning, exactly, yeah. So, you know, the staff have to come to these patients. It takes about 8 or 9 people, full PPE, to turn these patients around, and that has to be done, I think, pretty much every 4 hours or something like that. So I mean, that's nearly a full-time job in itself if you have an ICU of 10 or 20 beds to move people every 4 hours. So that's, and then you're contaminating your equipment with all this contact, and then it's hard to do what you're doing and not contaminate yourself. And they have this kind of buddy system. So if you're going into intensive care, there's somebody who watches you as you put it on, and it's so hard not to touch your face or not to touch your mask. And I saw one guy on the web, and I think he had taped his shoulders so he couldn't actually physically, taped his elbows so he couldn't actually touch his face. So I mean, if you had flippers and a scuba tank, it wouldn't be much more awkward. Like, it's, you're trying to do all the normal things you need to do for patients anyway, putting in lines and helping them breathe or giving them oxygen and all that kind of thing, and trying to do all that and not contaminate yourself is quite difficult.
So while we're on it, actually talking about the PPE, every time you touch a patient, is the PPE have to be redone, rechanged, or does it have to be?
So, yeah, if you're going to touch a patient, you really should change your PPE in between every patient, because you might be protected, but you could easily if you didn't change your PPE, you could easily bring the bugs from that patient onto the next patient.
So the eight people there that you were saying about when proning, because I've actually read a paper on that proning as well, and a woman was saying they should be proning, but there's always these parts. There's reasons why. Am I right in saying that there's not? Because they said that they always back in the day, I think she was saying, we always proned people when they came in. We put them down, and for people, especially with is it tiring or something like that? Is what when their lungs have tired from trying to fight and stuff like that, when they put them onto the ventilator. Just the paper that I read, but then the argument to it was the amount of people and the amount of PPE. Someone did the maths on it per people. If you turn 10 people, that's like,
and there's 9 people changing their gloves, changing their aprons, and everything else. It adds up. And I mean, thankfully, we haven't had a shortage of PPE yet. I think it's been a little bit close, and I think from what I can tell, the country's gone to enormous efforts to try and source it. And there are kind of nightmare stories about, I think, spending millions on a plane full of PPE, and then it pretty much gets hijacked by somebody with a higher bid, and it goes to another country. And I think, we probably need to work on becoming more self-sufficient in terms of our own PPE. I know there's a company in Limerick, and there's been a lot of people producing their own things. I know there's some people have been pretty creative with 3D printers in terms of creating masks and things like that. So, it's great to see the teamwork and the organization and everybody working together and pulling in the same direction, which is, something we haven't seen on this level before. But I think in the long run, we're probably going to need a lot of PPE, even when this goes away. I think some of the habits will remain because it might be gone, but it will probably still always be with us to some extent. So yeah, we need more PPE, and I suppose there's a business opportunity for people there in the country. I think whatever you can produce, we'll probably buy it at this stage.
Many people have stepped up, haven't they, in that way? Has Conor been by Tallaght yet? No?
Not to my knowledge, no.
I'm sure you're on his rounds. I'm sure if he finds out you're there as well, he'll want to see you, Jerome. I'm pretty sure. Conor never forgets a face. So phase 4 here. So the opening of creches, childminders and preschools for children of all other workers on gradually increasing basis. Return to work for those who cannot work from home. Gradual easing of restrictions for higher risk services, e.g. hairdressers, opening of museums, galleries and places of worship, travel extended to outside your region. So would that mean that 20th of July would probably be the earliest that you could, I don't know, book a holiday if you are a gambler?
Yeah, well, I suppose I think a lot of people should probably have their holidays at home this year. The countries you go to will probably depend what their rates are like, and there's probably a fair chance that if you go abroad, you'll have to stay in quarantine for 2 weeks when you come back, depending where you go.
Is that the case now?
What's that?
Is that the case now that if you're alive in Ireland that you have to quarantine?
I think pretty much. I'm not sure if it's true for every country, but I think so. Yeah.
Because I've heard in Australia when a few weeks ago, if you landed, it was literally the military, and they were taking you to places for quarantine for 14 days. Like.
So, I mean, I think here you probably go to your own house and you're told to stay in your own house. But yeah, in some countries, yeah, and whether they police that well enough, I don't know.
I think there is some leaks in it. Just as a citizen, as somebody looking in, I obviously not all of them, but obviously the situation with people coming in to pick the workers coming in. Now, obviously, I have no problem with any workers coming in, but to the country. My whole question about that whole situation was, if somebody, say a Ryanair worker, had COVID and had passed it to one of the people that were actually travelling to the country, and then they did quarantine for 14 days, is there a possibility 180 people could have got COVID? Now, obviously, it's over now because of the time, I think, passed, but to me, I know there are problems. I didn't see this in the way other people seen it, but that was my thing of like, but could everybody not now go together and then contaminate each other for 14 days? So say a bus coming from an airport, as we were saying there, we landed, and then you get the bus with 20 other people, and then we all go and self-isolate. Is that enough to kill the virus in that group of people?
I would hesitate to give any guarantees. This virus has never given us any breaks. The scary bit is it seems like there are people who can spread this virus without actually having any symptoms, which is unusual, and that makes it so much harder to track. So, we can't screen everybody who doesn't have symptoms. It's just not possible. There's too many people, and you'd have to screen them all the time. So, we have to focus on the people who actually have symptoms. And I think as we go through these stages, we need to have a really aggressive, rapid system that will, if somebody has any signs of a flu or a cold, they can get a test, get a result quickly, and if it's positive, then public health are called in. That person is sent home, and and their contacts are watched and asked to isolate so that you can shut this down as quickly as possible.
I was watching Monsters Inc. the other day. Do you know that? Yeah. And you've ever seen it?
No, but I've heard it.
But it's a funny scene that there is when a kid gets into the actual factory, and a kid is the most infectious thing in Monsterland. Okay. It's like helicopters. This guy gets shaved. Everything. I was like, hopefully this is not the name for this new normal. What they're talking about is because it's actually pretty funny, but it's a good thing. So phase 5. So here we are. So I've actually I took this from the HSE document. So this is the other broke down of this actually has the wrestling in it and stuff like that. Stuff that we've been keeping an eye on. Rugby was actually what I was looking at, because I was thinking, hey, if you can do a scrum, if you can put your head in, you can strangle somebody. So phase 5, the 10th of August. So all going well. Everything does well, and I won't just say everybody, because decisions being made as well still have to tell what the outcome of them is going to be. Sometimes it's like, it's your fault. It's we depend on what happens. If everybody goes to pub, yes, it's your fault. If everybody's not keeping social distance, it's your fault, and we will be watching. But it says allow larger social gatherings and return to work across all sectors on phased basis, commencing at the beginning of an academic year, 2020 to 21. Opening of primary and secondary schools and third level institutions, further easing of restrictions on higher risk retail services. So I think that's us in the idea of that. Here's a little plan that for our community. I'll give you the plan, and then you can tell me whether it's a good idea or not. You mentioned the idea of units, so the little the cells that you were talking about, as you just go in and one covers the other, so the buddy system. I know the radiographers have been doing it in a way where there's 5 people in a group, and if one gets sick, one person has to, that's all of them off at the time. And we've got that trains here, and we were thinking if we went back at the 10th of August and we did it where there was one class per evening in per area, so to start off for the first month, and then you had a system where there was 3 people, so you were only allowed to train with them 3 people within a class of say 20 people. So if you rolled with them 3 people and say one person, we could keep an eye on each other, like the buddy system you're talking about, and if one got a little bit sick, we do the Monsters Inc. on him, you know, we drag him out. He's not allowed to train then, or the 3 of them have to not train then for 14 days, etc. Is that a good idea for the first month rather than us all, as a community? I think it's better that we all come up with some sort of idea together, so we're not all in there.
I think that makes sense. I mean, by that stage, we're stage 5, and in theory, you're allowed to roll as normal, you know, and hopefully we'll get there on that date, but you know, it may not happen then. But I think it makes sense to try and restrict the number of contacts, because I think when you think about the amount of contact you have when you're doing 10 rounds with 10 different people, or you know, winner stays on and you change every 2 minutes, like that's an awful lot of contact.
And then go upstairs and do jiu-jitsu.
Yeah.
I was picturing the paint when that was happening. I was like, oh no. When that nurse was doing the contamination with the paint on her hands, I was like, imagine covering someone in red paint.
That's exactly what I had said before. Yeah.
Sorry. That was, you said that. Yeah, that you're actually the guy.
If one person was covered in paint, and you went through all the normal rounds, and you looked at everyone at the end of the hour, 2 hours. I'm sure you'd see red everywhere. Like,
yeah. It was your podcast with them. So you know, I'm pulling this information from good people because I've just literally just referenced so when people go back, my advice would be in as a community to go back as in a joint united approach, because there is the case where everybody goes back, one person gets an actual flu, and they're closed again. Am I right in saying that?
Yeah, and I mean, we probably will need some sort of system where we can test people in the community quickly. And whether, I think Ireland has done a reasonably good job in terms of the number of tests we can do at the moment, but probably need to be expanded even further. But I think it makes sense to start off with small groups, and maybe even just record who you roll with, or you know, set up a group of 4 or 6 people that stick together for that week or 2 weeks or whatever, and you just roll with them, and you know, and then if somebody does develop symptoms, you know straight away who are the most likely people that you've given it to or that have given it to you, and that would certainly help with the contact tracing, and it would try and at least limit it somewhat. Instead of one person giving it to 20 people on the day, you know, it might be only 1 or 2.
And the idea of jiu-jitsu being like, if there was a herd immunity ever, if it would work, if this herd immunity thing, and I know it has worked with other viruses, a lot of them would be with vaccines, with chickenpox and stuff like that. Am I right in saying that a community builds it up and it's built on itself? If there ever was one, you would notice it in a jiu-jitsu gym because
they'd probably be the first to have immunity, like, because they've been so exposed to other people. Yeah.
I was in the long mile gym with yourself, so I don't think I catch anything anymore.
You would think that, yeah. Unfortunately, there's a lot of things we don't have immunity, like various bacteria and things like that can keep coming back. So if we have immunity, well and good. Hopefully it'll last a long time, and then things will be able to go back to normal. Or whether that's immunity from the infection or from the virus or from the vaccine, who knows? But if not, then it's going to be tricky.
So 2 more things, and then I'll let you go, because I know you've had a long day as well. The percentage number of the kill rate of this virus in Ireland at the moment, I think it's 5.5, nearly 6%. With the Matt Stone rate. Were we right in saying that?
I think that's the case fatality ratio, which
Yeah.
epidemiologists would probably tell us that's not exactly the mortality rate, but it's a rough kind of estimate, yeah.
But some other countries have got at 1%, 2%, 3%. But are we going into this phase now at that number, or are we over the hill and now looking at these phases?
I would imagine the actual percentage doesn't really change. It's the numbers that change. So as you test more, I suppose then your percentage will change, and hopefully that would be less. So as you test more, you begin to pick up more people who might be much more mildly symptomatic or maybe even not symptomatic. So as the testing expands, you probably reduce that rate a bit. But I think by and large, I think we're doing okay in terms of our mortality figures. I don't think they're worse than other countries, and certainly our health system hasn't been overwhelmed, thankfully, and that would certainly have increased our mortality rate.
And the last thing, what I want you to do is I want you to give all of our love and respect to everybody, all of your colleagues, yourself. I thank you so much for doing this interview and giving us the information, because it's we're trying to find this and translate it in many different ways and be able to kind of figure out what's going on, because I think even the people that we would, I think you said at the start of this, I'm no expert. Well, I'm definitely not an expert, so we're looking for the information, and I just give all of our love and our respect to everybody out there. You are absolute heroes, and we are with us.
I'd just like to respond to that in terms of, I mean, we have, fantastic colleagues in Tallaght, like in the lab and with the infection control nurses and the ICU staff and the junior doctors and the nurses on the wards. But at the same time, the only reason that our ship has kept afloat is because people have done all the social distancing. I know that's hard, and it's going to be hard to keep going, but that's the only thing that's managed to protect us. And we have to thank everybody out there who's done their bit, who hasn't, broken the terms of their confinement, and have done their bit to help suppress this virus, because this has certainly turned out much better for now than what we expected. And I think we had about half the ICU beds that Italy had in terms of per population. So, there's a real risk there to our health service. Now, I think things have improved, and I think probably bringing in the private hospitals and that sort of thing has increased our capacity. But there's a real risk that we will be overwhelmed if there's a second or third wave and people don't do the social distancing. So I guess I'd like to thank everybody who has, and I suppose as the measures are lifted, I would urge people to still try and make trying to make those exceptions, meeting people as the exceptional behavior, and try and still limit somewhat what they can in terms of the number of people they meet and have close contact with, because that's what's going to keep our health service afloat.
Well, someday, in probably next summer, we all get to look back at this and say, do you know what? While we're strangling each other on this sunny day, and it's just steam on the mat, we can all remember that madness that was going on.
Yeah. Well, hopefully, we'll see the end of this nightmare. But
hopefully, Jerome, thanks so much. I really appreciate that. I just had to stop. So there you have it. I had so many more questions I wanted to ask. I had to respect, you have to respect Jerome for coming on, and it's hard to be in a position where someone's asking you questions about the facility that you're around and what's going on, and you obviously Jerome doesn't want to offend anybody either, but I think he's a straight shooter and he's a good guy to be able to get that information off. So I'm happy with that. I hope some of you are happy with that. I was going to ask about the breaking down of the small groups in training and stuff, but I think he kind of answered that in a way, and I think any of the fitness industries out there that I've been seeing talking online about, that means one group and two group and stuff. I think you need to be very careful about how we go forward with this, and I think even inside strength and conditioning, they need to unite together, dance schools uniting together, jiu-jitsu, karate, all of these things. I think a unity, so a unit, a support as a unit going forward, and making the choices as a unit going forward, I think is a smart choice in this one, because I think if we do it individually, people are going to end up eating each other, and not only that, they're going to end up blaming each other and causing all sorts of trouble in each communities that I labelled there above. But keep safe, look after yourself, and Happy birthday to the hooligan. You up out of it. 32. Never thought I'd make it. I didn't think I'd make it. Have a good time.
Peace.